James Erickson with EMC Dental Marketing at emcdental.com. Today we're going to talk about something very important when it comes to building relationships with your current patients, as well as generating those referral patients that we all like to treat. If you're any fan of my all referral practice teachings, you know that setting the stage is a very important part of generating more referrals. We're not going to talk about an all referral practice today, but we're going to talk about one little change that you can make starting tomorrow, or actually today, that could generate you more referrals and create a little more interaction between you, your staff, and your patients. And that one thing that you can change today is adding an easy conversation starter to your practice. Now, what do I mean by an easy conversation starter? Well, if you stand in the waiting area of your practice and look around a little bit, you'll notice that the same pictures have been on the wall for the past 2 years. You have the same furniture that has been there for maybe 5, 10 years. Everything looks the same. Now, I'm not talking about a total renovation of your office. I'm talking about adding something that's going to not only shock, but it's going to create a focal point in there that your patients can't help but comment about. Now, you're trying to think of what I'm talking about here. There's a lot of things out there. One thing that I found is really popular that I've started sending to my clients is something like this. It's a tooth lamp. Nobody really has these. In fact, if you look around on the internet for them, you're gonna find them probably around $200. But they're very popular. I started sending them out to all of my clients in hopes that they would put them somewhere where a patient can see them and say, "Oh, that's cool," or "Hey, where'd you get that tooth lamp? You know, I need something like that." But what it does is it creates those type of comments. It creates something new, something fresh, that when somebody comes into your office, it's not the same old furniture, the same old magazines, or the same old pictures on the wall that they're used to seeing. What they do is they see this piece and they comment to you about it. "Oh, wow, that's a cool whatever." You know, everybody's seen these 6-foot tall toothbrushes online or on TV, but rarely do I see a dentist's office that has a 6-foot tall toothbrush in it. But it's a great way to create a conversation. And you need to add these easy conversation starters about every 6 months, because that's when your patients come in for recall appointments. So as your homework, I'm going to make this short and sweet. As your homework, every 6 months, I want you to add something that is a great conversation starter. Maybe it be the 6-foot tall toothbrush. Maybe you go online and find yourself a tooth lamp of some sort. Maybe it's a picture of you next to your boat, or next to a big giant fish you caught. Or maybe it's one of those demotivators.com. It's a funny poster. Something to add some interest, to create a conversation between you and your current patients. And what that does for you, not only creates a conversation between your staff and patients, or you and your patients, but it also gives your patients something to talk about when they go back to work. When they go back to their family, they can say, "Oh, you'll never guess what I saw at Dr. So-and-so's office today." So it will generate referrals. It will generate a little bit of buzz around your office. I'm not going to say expect 100 referrals because you put a tooth lamp in your lobby, but expect people to be talking about you more. So like I said, as homework, every 6 months, try to look to add that easy conversation starter to your practice and see what happens. So this has been James Erickson. For any more information on any of our dental marketing products and services, visit emcdental.com. Visit emcdental.com for more dental marketing articles, as well as all the information on our turnkey dental marketing services.